As 12,000 members of the American Diabetes Association assemble for the 83rd Scientific Session, this is the premier global gathering of those fighting against the deadly consequences of diabetes. And we are here to highlight the remarkable research being unveiled. Welcome back to the San Diego Convention Center. You're watching ADA TV, and I'm your host, Autria Godfrey. With more than 1.4 million new cases of diabetes diagnosed each year, we are turning our focus to epidemiology today, as diabetes education and prevention is more important than ever. Today, up first, we host a panel discussion weighing the pros and cons of a low-carb diet during pregnancy. Plus, groundbreaking research coming from China. The discovery their scientists are calling a game changer when it comes to treating type 2 diabetes. And it's not all work and no play. We find a little time for fun at the ADA networking reception. We are covering every angle of this year's gathering, and there are plenty of ways to catch all the content. You can always find the latest ADA TV episode on our TVs placed throughout the convention center, on the in-house channels at several of our partner hotels, on the shuttle buses to and from the venue, on the ADA Scientific Session website, and on our Twitter and YouTube pages. Now, here to start us off once again is Dr. Alice Chang with what's ahead on this Sunday at ADA. Hi, Dr. Chang.
Thanks again, Autria. Sunday morning at 8 a.m., there will be a symposium on automated insulin delivery use among pregnant women with type 1 diabetes, past, present, and future. Then at 9:45 a.m., we will get to hear from Dr. Radhika Busui for the American Diabetes Association President Medicine and Science Address, which will be immediately followed by the Banting Meadow Lecture by Dr. Matthias Schopp, called Overcoming Obesity, the Discovery of Multi-Receptor Drugs. Then at 1:30 p.m., there are several e-poster theater oral presentations, including very exciting late-breaking abstracts. At 3:15 p.m., the theme of multi-receptor drugs will continue with a debate titled The Dual Incretin Duel, you like that play on words? Between Drs. Earl Hirsch and Carol Wisham, guaranteed to be entertaining and educational. Then at 4:30 p.m., very excited to see the results from the OASIS 1 and Pioneer Plus studies of high-dose oral semaglutide in diabetes as well as in obesity. Another jam-packed day.
Now from XOStem Biosciences, a groundbreaking encapsulated islet transplantation therapy aimed at overcoming the limitations of current treatments and providing a long-term, cost-effective solution for every person with type 1 diabetes. Check out this medical breakthrough.
Here at XOStem Biosciences, our dedicated team of academic scientists share a common goal: the elimination of type 1 diabetes.
Our survey from around 500 diabetic patients revealed a significant preference for encapsulated islets in microcapsules, making it the chosen therapy by diabetics for diabetics in our survey.
Our goal has been to develop a solution that can be made available to any type 1 patient at a reasonable cost, performed as a less invasive one-time outpatient procedure. We have no limitations on our islet source, exosomes, and biomaterials, making this an inclusive solution for a wide range of type 1 diabetic patients.
Exostem is a very lean organization, but we have a laser focus on our vision, which is to beat type 1 diabetes.
This week, the ADA continues to honor academics, healthcare providers, and educators who have contributed substantial advances in the field of diabetes care and research. Here now is President of Healthcare and Education, Janet Brown Friday, along with this year's outstanding educator, Dr. Enrique Caballero.
I think an outstanding educator is somebody who thinks about the people first, somebody who thinks not just about the content, but who the content is being delivered to. The people who are getting the content from you understand and are able to act upon what you're trying to teach them. As President of Healthcare and Education, my focus is looking on all the aspects of healthcare and education that are concerns of people who have diabetes. What information are we going to be able to provide to not just the people who have diabetes, but to the educators, so that they know how best to go forward when they are presenting information to people or patients with diabetes.
Do your little bit of good where you are. It's those little bits of good put together that overwhelm the world. Friends and colleagues, let's overwhelm the world. Thank you very much.
This is the best time in history in terms of technology, medications, knowledge. Yet, most patients with diabetes are not achieving treatment targets. There's a gap between what we know and what happens in clinical practice. In regards to patient education, we live usually in multicultural societies. So when we develop programs, we need to tailor the education to the communities that we want to serve. And that means taking into consideration language, culture, socioeconomic level, health literacy, education level. Professional education side is also important to develop programs that are targeting the audience, the recipients of education. It's not just providing information, but it's helping healthcare professionals utilize that information in routine clinical practice. And all the players in diabetes care, because we need to emphasize what's important. We're not there yet. We're doing great, but we still have a long way to go. And working in education is truly the best way to eliminate that gap.
One of the key highlights of the scientific sessions each year is the emerging science resulting from clinical trials. We caught up with Dr. Alice Long, who unveils the latest findings on using immunotherapies in the fight against type 1 diabetes.
Just this fall, we had our first drug approved for type 1 diabetes, and that is teplizumab, and it will delay onset of disease for up to 3 to 4 years in the trials that was shown. And so this is super excited because until now, we really have only had insulin and kind of engineering to help treat type 1 diabetes. And this really will open the door for many, many opportunities to come. Currently, we have several trials that are going on through the TrialNet and through ITN, and there are other groups also. But through TrialNet, we have one in the prevention space, which is ATG, and we have some others that are opening very soon in the recent onset space. Those are the ATG trials for adults, and we'll move down to children once the drug is tested first, and the others will be in both age groups. Prevention teplizumab was just approved, and so that definitely does delay the onset of disease. And so that's tangible, it's real. Those added years are a lot, particularly for young children. And I think just an optimism in the field in general, that there is a therapy now and there will be more to come. And I think just the fact that we're in there and we're trying new things and we can learn from the entire field of autoimmunity, what worked in other autoimmune disease and beg and borrow, what's working with checkpoint inhibitor therapies, beg and borrow from those groups, that really, and also add in the beta cell health drugs of verapamil, DFMO, any of those treatments where we can do combination therapies. I just see we're a little late to the game for autoimmunity treatment in general, but we are going to bring so many partners to the field that I think we're going to move really fast. Increased options. Yeah, I mean, everybody wants to make a choice that's best for them, and the more choices we get out there, the better for everybody.
The discovery of a novel glucokinase activator is a potential game changer for type 2 diabetes treatment. But to understand how and why this works, we have to look at its role in glucose homeostasis. Let's see how China's Hua Medicine is taking the drug through clinical trials and straight to market for type 2 diabetes patients.
For type 2 diabetes, the blood sugar set point is raised. That means abnormal homeostasis. I'm very impressed by Hua Medicine for the development of glucose activator. Those are guiding first medicine to use glucose homeostasis concept in patients.
We have investigated dorzagliatin in 17 clinical trials. Significant amount of patients maintained the stable glycemic control, which we call diabetes remission. Dorzagliatin was approved for type 2 diabetes patients in China. In Nature Medicine, Professor Jiang Bius wrote dorzagliatin is a new class drug in the diabetes toolbox.
And along with that discovery, China is redoubling its efforts to improve the health of its citizens through the Healthy China 2030 project. With diabetes as a core focus, Hua Medicine, with their new glucokinase activator research, they're making a difference in the health of people with type 2 diabetes.
目前据估计应该有1.4亿左右的糖尿病病人。dorzagliatin 呢，应该说也作为一个新的手段，能够对中国的健康中国2030当中2型糖尿病病人的达标计划，应该也有所帮助。
Dorzagliatin is a novel class of diabetes drug just get approved by China regulatory agency and launched in China.
因为dorza应用了以后，特别是在合适的人群，能够很好的恢复贝塔细胞功能。
We have started to learn how to regulate the homeostatic process. This process will help to stop the progression of diabetes, to prevent diabetes, to get diabetes remission so that we can cure the diabetes.
The concept of going low carb during pregnancy to treat gestational diabetes is one that's been hotly contested. And here to do just that is Dr. Amy Valent and Dr. Terry Hernandez. Thanks for your time this morning.
No, thanks for inviting us.
Thank you.
All right, let's get started with where this concept for a low carb diet as a treatment option for gestational diabetes even came from.
Yeah, you know, it's a really great question, and sometimes we can get our answers from history. We realize that within the era of insulin, that not only does blood sugars save people's lives while they're pregnant, but also by controlling blood sugars that we're able to actually make differences in perinatal outcomes. So from that, obviously, others, experts in the field, up until the last probably 50 years or so, have kind of demonstrated that there's a correlation with carb consumption and blood sugars in pregnancy. And so based on that, we've kind of evolved into kind of going more towards lower carb intakes during pregnancy for treating diabetes in general.
Dr. Hernandez, you are not in favor of a low-carb diet to treat gestational diabetes. Is that because you don't believe that there's kind of a one-size-fits-all nutrition approach for patients?
I think my position on this is really in favor of creating options for women.
Dr. Valent, though, is there
data to back up a low-carb diet for those with gestational diabetes?
From specifically looking at gestational diabetes and low carbs, there are more data that are coming out that people are looking at differences in carbohydrate content. At least it's not showing, for what data is available, is that it's harmful per se when we look at pregnancy outcomes, but the data isn't robust.
That's so fascinating that you said it might not be harmful. It leads me right into my next question. Do you believe that there could be some negative side effects for women who adopt a low-carb diet during pregnancy? What would those be?
I think the best way to frame that question is, what are the potential concerns or questions about going below, low carb, meaning either 40% of total calories or 175 grams per day, which, by the way, are two very different questions. First, mother's physiology and how it's tightly integrated with the baby's physiology, the fetal physiology, really depends on the idea that mother's glucose needs to be higher than the baby's. So if mothers, theoretically, cut enough carbohydrate and don't take in enough glucose, that gradient that ensures the baby gets the right energy from mother's glucose could be jeopardized. The second consideration is exposure to ketones. So as carbohydrate intake is further reduced, across kind of a continuum, mothers can become ketotic, and in pregnancy they're prone to that anyway. And so there are some concerns that could jeopardize the baby's intellectual development and development of the brain. And then two other quick considerations are micronutrient deficiency. So I just think that we need to be very intentional if women are on a lower carbohydrate diet option to make sure that their micronutrients are supplemented. With reduced carbohydrate typically comes with higher fat intake, and so I, with others, have raised questions about if that heightens maternal insulin resistance.
Dr. Valent, final question goes to you. We've been talking about a low-carb diet as a method to treat those with gestational diabetes already. For those who do not have it, and might be considering adopting a low-carb diet as a preventative measure, what do you say?
Certainly from lifestyle studies, there is a lot of heterogeneity to those types of studies. Nutrition studies are really hard to do. And at least for now, it doesn't seem to be that low carb potentially would be preventative. But I think it's also part of the pathologic process that we need to have a better understanding of the natural process.
Thank you for both of your perspectives. Appreciate it.
Thank you so much.
The ADA's National Health Disparities Committee is thrilled to highlight the abstracts presented this year that are having a meaningful impact on addressing and improving health disparities. Here now is Committee Chair Dr. Ashby Walker.
There were so many amazing abstracts this year that were submitted that were related to health disparities and the promotion of health equity. And as a committee and on behalf of the entire committee, we want to applaud all of those efforts. We select abstracts for the top 10 health disparities abstracts that we showcase. Based on word searches, we look for words that are related to social inequality, socioeconomic status, race, ethnicity, social determinants of health. When you look at health disparities in diabetes, there are well-documented differences in health outcomes for people living with both type 1 diabetes and type 2 diabetes based on things like socioeconomic status, race, and ethnicity. So while we know that these disparities are pervasive and long-standing, what we really want to do now is focus on what to do about it. Well, this year, what we saw in several of the abstracts that were highlighted as top 10 are that people are really getting intentional about looking at aspects of the built environment that contribute to health disparities. They were all, in similar ways, trying to identify who needs intervention. I can think in particular of one abstract that dealt with redlining. So we know that there historically in the United States, there's been tremendous residential segregation in neighborhoods, but this particular group actually was able to connect redlining to risk and disparities. The 10 that we selected in particular, we just would like to extend to those groups our congratulations because they stood out amongst a very competitive cohort of abstracts.
Steno Diabetes Center is one of the oldest diabetes hospitals in the world. With some of the world's top researchers, staff are undertaking groundbreaking work in areas including GLP-1 agonists, the impact of diabetes on the brain, and kidney disease. Let's see why Steno is not only the ideal place to be a patient, but also a great place to work.
Here at Steno Diabetes Center, we have a very clear ambition to be a global leader in diabetes and complication research, but also for developing new and progressive treatments and care pathways. It's a whole ecosystem that we hope to provide.
We have a very active patient collaboration unit. We have a very interactive treatment unit that interacts with researchers and clinicians alike.
We do research, we understand why things work, we test, demonstrate it works, and then we implement in the clinic. And we can do all here at Steno Diabetes Center.
And we do have also the education department who can tell about the research. Many different departments are really supporting each other to give better treatment for our patients.
With my PhD students, I use as much time as possible to get them inspired, to do more research, to take the science into the patient, and I love to see their development.
There is so much to see here on site. Make sure to stop by the sales pavilion on the upper level. In the ADA Shop Diabetes bookstore, you can stock up on the latest professional publications and resources and show your support with ADA gear. And don't miss the membership lounge. Relax, have a snack, and charge your device while ADA staff answer any questions about membership renewal or benefit. And now open in the exhibit hall, the ADA booth is a must-see while you're here this week. Face-to-face networking is an essential part of each year's scientific session. Let's check out this year's networking reception.
We are about to cut the ribbon and start.
Super excited to be here. This is my first time. I am in marketing for EdgePark, so just excited to see how we can really drive value for not only our manufacturer partners, but also our, the patients that we serve. I'm excited to see the products in the flesh in real life and just meet people and network.
I am a certified diabetes care and education specialist, and I have an abstract that has been accepted, so I have a poster that's being presented. But meeting people and networking, I've met friends I haven't seen in a while. I have met some new friends here, so it's been exciting to see what we're doing that's similar and a little bit different and learning from each other.
I'm most looking forward to engaging with our manufacturer partners that are here at the conference as well, learning about the new products that they're bringing to market to impact patients living with diabetes. The American Diabetes Association is a powerful organization that meaningfully impacts patients living with diabetes.
We are asking the question today, where lies the key to type 2 diabetes prevention? Is it in population health or personalized medicine? Here to debate that very topic is Dr. Sridharan Raghavan and Dr. Lisa Steinmetz. Thank you both for your time this morning.
Thank you for having us.
Dr. Steinmetz, I want to get started with you. Let's set the stage. How do you define population health versus personalized medicine?
Population health and public health is what we do as a society to protect the health of neighborhoods, communities, and larger populations. Personalized medicine, in contrast, has more to do with the patient or the individual and what we can do to set them up for good health. And often that's referring more to a clinician-patient interaction.
All right, so to make this a proper debate, let's set our point of views. You do believe that public health efforts are the way forward.
That's correct.
How come?
Well, if you think about what's really driving health problems, and diabetes is a huge problem, the prevention of type 2 diabetes is really going to require us to address those problems. What are they? It stems with problems from the individual level, but also includes problems related to interpersonal relationships, to the context in which the individual lives in, the way in which sectors influence behavior, even the society and the norms, the cultural norms around how we act, behave, live, our abilities to choose certain behaviors. All of these multi-level factors are really influencing disease risk. And so we need to target all of that at one time. That's why I think public health is the way to go.
And Dr. Raghavan, on the flip side of things, you believe that a more personalized approach might be the ticket?
At the base of everything that Dr. Steno has said is the individual, and many of the things that prevent diabetes require individual behavior change, whether that's taking a medicine, changing lifestyle factors. That's where we're really failing at diabetes prevention right now, I feel like, is motivating folks to adopt healthful change behavior, and that really is where we need to improve our sort of approach to personalizing.
To his point, don't you believe that there is some sort of personal responsibility that has to factor in?
A public health approach doesn't really negate or say that the individual doesn't have a role. However, if we don't address these broader societal factors, we won't really be so successful. Part of what influences the individual behavior is those societal factors. And so we really need to account for the social determinants of health that is driving health and disease.
Dr. Raghavan, without the public health component, wouldn't we be setting an individual up for failure, do you think?
That's a tough question. I think we have to also think about what's available now. And right now we have approaches that require individual buy-in. And so I don't think they're mutually exclusive, but at the moment, when we have personalized strategies, we have multiple options available for a person. When we talk to patients in the clinical context, we have to figure out what they're able to do and why they can't do other things, and then tailor the appropriate approach to them.
Final question for you both. Is there a path forward where both the public health component and personalized medicine can work in tandem? The dream goal, I guess.
Absolutely, 100%. I think that if we acknowledge the limitations on both ends and address those in developing solutions comprehensively and integratively, I think we can reach that point. Specifically, I would say that the limitations of personalized medicine, as relying on data and machine learning and artificial intelligence, that we need to really be clear that if we don't have data on individuals who are not accessing healthcare, not seeing practitioners, and 90% of people who have prediabetes don't even know they have prediabetes. So they may not be interfacing with healthcare.
Dr. Raghavan, final thoughts to you. Is there a way where both worlds can come together?
Yeah, I mean, I don't think anything we've said is mutually exclusive. I think this contrast is probably more a result of sort of individual priorities and personal preference than anything else. And I think there's plenty of opportunities for growth in both areas, and they're both necessary.
Wonderful. Thank you both so much for your perspectives today. Thank you for your time.
Thank you so much for having us.
Braden Diabetes Center's team of experts is united by a vision to empower patients and give them the tools and techniques to live a healthier life with diabetes. Whether it's a child, adult, a pregnant woman with type 1 or type 2 diabetes, this program can teach better diabetes self-management techniques that can help patients feel both physically and emotionally better.
So Braden Diabetes Center is the American Diabetes Association recognized comprehensive outpatient facility of Burn Health Medical Center. We offer state-of-the-art diabetes self-management education, which is accessible, patient-centered, and meets the needs of our community. We offer a broad range of innovative services and support for our patients, their families, and caregivers to effectively manage diabetes and prediabetes.
What makes the center so special? I think the team-based approach is certainly very helpful. Patients really do enjoy meeting with a nutritionist, as well as having a team that really cares about, their insulin levels, their blood sugars.
These patients stay with us for multiple years, so we develop a personal relationship with them, which really helps give them empowerment to better manage and treat their diabetes.
It's been a busy third day here in San Diego, and as you've witnessed, we are seeing rapid advances in the research and development of technologies to better treat diabetes. We hope that you have enjoyed learning about all the remarkable work currently being done. Remember, you can go back and find all of today's content on our TVs placed throughout the Convention Center, on the in-house channels at several of our partner hotels, on the shuttle buses to and from the venue, on the ADA Scientific Session website, and on our Twitter and YouTube pages. We have still got one more full day of diabetes coverage right here for you tomorrow. We'll see you then on ADA TV. Have a great one.